Okay, well, we are a couple minutes past 7, so we'll go ahead and get started. And then as people start to roll in, they can kind of catch up from where we're at. So let me just take a couple minutes and I'll introduce myself. My name's Tammy Snedeker. I am one of the members of Emergency Management Growth Initiative, working with Lorraine and Lewis and the rest of the members of the organization. We are working to make the field of emergency management more visible and more accessible to the next generation. By one of the goals is to try to make people more aware of the different branches or sectors of emergency management. This one is focused on public health. We have 3 speakers and a moderator that are all from different fields within the public health, and I'll give each of them a chance to introduce themselves, a little bit more about their background, and then we can let the moderator take over. So first we will start with Scott. Go ahead and introduce yourself.
Good evening. My name is Scott Nicolunas. I'm the Director of System Emergency Management and Business Continuity for Penn State Health. We're a central Pennsylvania-based health system comprised currently of 3 hospitals, 4 hospitals, including our children's hospital, 2 community hospitals under construction right now, a large outpatient practice site, and an academic medical practice through Pennsylvania State University. So a lot of risk in our organization, and I'm about 2 months into my role in there. I came from the Pennsylvania Hospital Association of Pennsylvania, the state association, prior to that, where I managed the emergency management program for them. So it's great to be here tonight. I look forward to chatting through the evening.
Thank you, Scott. Next on my screen is Latoya. Go ahead and introduce yourself.
Everybody, my name is Latoya Simmons. My background is more in public health, and so from there, my biology experience coming out of college, I was able to land a job at a lab. So I did a lot of tissue processing, human tissue processing in the past, and then from there moved on to CDC. I stayed there for about 10 years, where I worked on infectious disease outbreaks, specifically and from the emergency response standpoint. Really enjoyed that, did a lot of local things, national things, and worked on some international outbreaks as well. And just a few months ago, I accepted a position at Health and Human Services in the DMV area, and I'm functioning as an emergency management specialist in the Office of the Surgeon General.
Thank you, Latoya. And Cydney, go ahead.
Hi, my name is Cydney Justman. I'm a Senior Emergency Response Manager at Direct Relief, which is a nonprofit focused on health, supply chains, logistics, and emergency response. I've been in my position for just about 7 years now, and actually really didn't envision this to be my career path, but I love it and feel very passionate about it. I started out seeking a career path in anthropology and cultural studies with a health perspective, but that quickly changed to emergency response, and it turns out that everything I had learned prior was really applicable, and we'll get into that later. But nice to meet you all. Thank you.
Great. And before I let Kim introduce herself, because she's our moderator, so once she's done introducing herself, she can kick off the questions. I just want to let everyone know, if you have any questions as we go along, you'll see the Q&A down at the bottom of your screen. Go ahead and submit your question. If it's something that we can answer while it's going on, watch for a response. If it's something that we feel should be discussed, then we'll go ahead and bring it up in discussion as well. So feel free to go ahead and use the Q&A at the bottom. And Kim, go ahead and introduce yourself.
Hi, everyone. I'm Kim Stonebreaker. I'm the Manager of Safety and Emergency Management for WellSpan Ephrata Community Hospital and WellSpan Good Samaritan Hospital. So I'm with the WellSpan system. We're also a health system in Central PA, 8 hospitals across 6 counties, 6 or 7 counties. So quite complex. Myself, same thing. I didn't really start out in this profession. All of my background is in IT, so several years in IT, and serving on the emergency management committee for the hospital turned into a position in emergency management. So here I am. Welcome, everyone. Let's get started tonight. So I believe our first question tonight is, how do I start? What can I do to get into the field?
And we'll start with Scott. What is a good way that you feel would be a great way to get your foot in the door?
Right, well, I think education's important. Anytime you see job openings now in the field, that typically they'll require some type of formal education. But I think a good place to start to see if this is the right direction for you is to dabble in some of the independent study classes that FEMA offers. Get into some of the educational programs through the Emergency Management Institute, and just see if this is what you want to do, and determine what path you want to take within the profession. I think one of the things that's really interesting and nice about our profession is the ability to go down many different ways, from healthcare to government-based emergency management, private practice, and now you're really starting to see business continuity efforts come into play here. And I think there's a lot of different paths that will open up here in the future post-pandemic that will create a lot of openings for people in our with our background.
Sounds good. Cydney, you had a different path. What do you recommend from your perspective?
Sure. So what's really also wonderful about this field is that there are so many different entry points. So really play to your strengths, whatever is of interest to you, whatever your background already is. If you feel passionate about that, find the way that skill set is applicable to emergency response. And, we'll be touching on some of those areas during this panel, but there's so many different entry points, and people really what we need is people that are really well versed in their skill set and comfortable in applying it in situations that need quick response and quick critical thinking. And so just whatever kind of education or training that you're taking on in order to equip yourself for emergency management, just know that you're learning a skill set that may not be immediately evidently applicable to emergency response, but that it will come into play later, and just really keeping an open mind. And I'd also just recommend learning a second language. Probably definitely the most valuable skill set that brought me to my career, learning Spanish.
Yeah, I wish I would have kept up with Spanish after high school. Latoya, do you have anything else to add? I know you've kind of changed your course too along the way.
Yeah, sure. So I have to piggyback off of what Cydney and Scott already said. I love that Cydney mentioned that you should really follow your path and what the things are that you like, because you never know if an aspect of that could be part of emergency management. I love what Scott said about education, and also what Cydney said about sort of getting your hands dirty. So in terms of sort of bringing all of that together, one of the things that I did early on, I actually always thought that I was going to work in a lab. I never thought emergency management was even a thing, it wasn't even on my radar. But I loved volunteer work. So one of the things that I used to do just outside of my schoolwork or outside of professional work is volunteer with the Red Cross. They sort of had an emergency management arm locally. And so one of the things that I used to do is help victims who had experienced fires and were displaced from their homes. It sort of gave me a sense of purpose and belonging. And I always just wanted to help people. So I felt like I was helping people. I was doing it under a reputable organization. And so I was being trained by some really incredible people. Little did I know that sort of thing that I was doing in high school would really come back around full circle into my professional life and actually help me understand what it is to think quickly on my feet, what it is to, especially during a fire or some sort of traumatic event, what it is to help calm people in a really stressful situation so that we could collectively move forward together. At that time, it was fires and trying to get people housing, whether it's temporary housing or some permanent housing, and making sure that they have like washers and dryers and refrigerators and stuff in their home for their families. But now it's on a different scale. It's making sure our nation is safe and trying to do the best I can with that under a lot of pressure. Really, the education component is so important, but I think that hands-on experience is even more important in some cases, because what you learn in a book, in a textbook, is not always what's going to play out in the real world. So being creative, thinking on your toes, being resourceful is really, I think, what I've seen is most useful for myself and for my colleagues in emergency management. A lot of people don't think about creativity being a part of emergency management, but it totally is. Especially in the midst of a response.
That's a great answer. All right, Kim, go ahead to the next question.
All right. What are some examples of healthcare emergency management systems, processes that are different from traditional emergency management programs?
That's probably going to be a good question for Scott.
Put me on the spot. No, I think, there's healthcare is really becoming a niche field in emergency management, or a niche position in emergency management, because of the unique needs that correspond to it. In some cases where you have large organizations like the one I work for, there's a research arm that encompasses part of the organization. We have a children's hospital, we have a trauma center, and large adult facility, as well as an academic medical educational component. There's so many different planning aspects that you have to consider in your risk analysis and assessments, that it really kind of specializes the needs that you have to deal with, and specializes the planning that you do. So it is, in a way, becoming a very unique subset of the profession of emergency management. Of course, with the development of HICS and the Healthcare Incident Command System, that has changed not changed, but it's aligned some of the incident management components specific to healthcare. But I think if you could take one thing away from what healthcare, what we do in healthcare, that might be just a little bit different than traditional emergency management, I think it's the ability to be flexible and to adapt to the specific needs of the organization and to the field. It's slightly different from the general government-based programs that we're all familiar with. And I think the more that you can be flexible, that you can adapt to those organizational specific needs and the risks that are associated to your particular organization, the more successful you'll be in the response and recovery efforts when you have emergencies that occur.
That is great. All
I
right.
can just add on a little bit to that. And that is, thank you. That was really great, Scott. So our work is not in healthcare management, but rather like health supply chain and logistics. And what we always find is that we actually need to revert to like the most basic technologies and communication tools and transportation tools during an emergency, especially like large scale set and onset emergencies. For example, inventory management software, just most of it is online. And so that is often the first thing to fail. So we have inventory management software that is actually designed to be used offline and like on really, really low, like low tech computers, and can be installed and trained upon really, really easily. So that is like one really distinct, like we would never want to use that kind of emergency inventory management tool outside of emergency response, right? But the situation often calls for it. So learning how to be adaptable in that, like learning how to deal with more rudimentary tools and communication and whatnot.
I'll chime in next. I think from my perspective, coming from sort of a biological lab background, I think one of the things that I guess has helped from a public health standpoint is taking that science and kind of merging it with public health, and then also merging it with the third component, which is emergency management. I think, you know, a lot of us have worked on previous responses, infectious disease responses, whether it be Ebola or Zika, and in this case, COVID-19. And so one of the things that I think was really unique about this COVID-19 experience is that there were so many people who were more science-minded and lab-minded and lab-based, which is good, we need that. And then there were so many people who were emergency managers, which is great, and we also need that, that everyone was so used to working in their silos, right? In their specific areas of expertise. And so with COVID-19, the two had to overlap. And so I think kind of what Scott was saying, that flexibility component is going to be really, really important. Working on a group project, if you will, is going to be really important, learning how to deal with different personalities. And then learning that these infectious disease outbreaks are often pathogen driven. So we have to look at the pathogen's behavior, where they like to live at, how quickly are they spreading, to know where to allocate our resources to for logistics, or where to allocate our resources to for hospitals, for example, whether it's laboratory support, humans that need to support a response, or things of that nature. Especially, we saw that a lot with nursing homes or closed facilities, long-term care facilities, and we're still seeing that for this response. So I think we think of emergency responses oftentimes in terms of weather related, or you know, mudslides or something like that, or floods or ice storms, especially here in the US. But sometimes the emergency responses are infectious disease and biologically driven. So we have to sort of take those experiences that we have, especially if you are a nurse or a nurse practitioner or interested in that realm. There's a public health arm of that is really important in infectious diseases. If you're a medical doctor, if you're an EMT, if you're triaging, whatever your expertise is or whatever area you're really interested in, that component is absolutely necessary in some way, shape, or form in terms of emergency management.
All right, thank you. And what are the key elements that healthcare executives expect from their emergency managers and emergency management programs? Scott.
So the first and foremost, I probably will start with a statement, and I think this has just been the experience that I've had over the years, and that you know, the healthcare executives do a really, really good job at running healthcare organizations, but for the most part, they really don't know a whole lot about emergency management. So they're expecting us to be the subject matter expert, to bring the organization, the calm, the control to the unknown and no notice events that occur within our organizations, to be the go-to person to organize all of these individual groups and entities that make healthcare systems work together, to help organize response, recovery, the allocation of scarce resources, and generally be able to continue the business of providing healthcare in the community through disasters. So it's really a huge role for one person, and that's typically, you know, what I've found in healthcare from a staffing perspective is this is relied upon typically by a one-person team to bring all those people together. So the expectation is here that you're establishing the relationships within the organization, within the community. You're maintaining the requirements of your accreditation standards, whether that be Joint Commission or other, that you're making sure that you're compliant with CMS, so that when these events do happen, you're not only prepared to respond, you do respond, and you do so with the resources that you've spent, you know, hopefully spent time building up throughout the preparedness phase. So, you know, I think they look to us to be those subject matter experts. They look to us to be the leaders and to help to coordinate that leadership effort among people who generally don't live in this world day to day. So there's a lot of expectation that comes out of leadership to ensure that we respond effectively.
Thank you. Cydney?
So again, I'm not in healthcare management, but what we look for when we're looking for team members is somebody that can clearly demonstrate that they are able to quickly make decisions, analyze a situation, integrate various forms of information and sources of information into a decision without being reactive. So it's really, really easy to want to react to a situation, especially when there's like a really great need from a community. But being able to take a step back and take the necessary time to analyze risk, both to yourself, to personnel, to the population that that is in need, and then looking at scarce resource allocation as well for both short-term and long-term. That's definitely, it takes practice. Nobody just knows how to do that, but somebody that can demonstrate at least like the willingness to learn and to cultivate that skill set is really, really important, because I think a lot of time and resources are often wasted by premature actions or decision making that really end up not making sense. Yeah, I could go into that for a lot, but just like the ability to react without being reactive. And just keeping a clear head and not getting swept up in the emotion of a situation, which is really hard to do because we're all human.
All right. Latoya?
For me, I look actually for the same thing that Cydney and Scott are looking for as well. Definitely resourcefulness, definitely someone who can who's not reactive, who can really function under pressure. A lot of these responses, especially when you get to these large scale responses, there's a lot of pressure, there's high demand, there are extremely long hours, day after day after day. Sometimes you don't get weekends off, things of that nature. So definitely looking for someone who's not only a hard worker, but who's resilient, who can sort of bounce back if at all possible. In addition to that, people who are good at working with other people. I know I've mentioned, a group project a second ago in my last answer, but seriously, it's one of the strongest, qualities that I personally look for when trying to build my team up. Without team members who are used to working under pressure, or at least open to working under pressure, who are willing to work together, I think it really does a disservice to the communities that we're trying to serve, whether it's a local community, a state community, or the entire United States in the case of COVID. So there's some soft skills that I think not a lot of people focus on in emergency management that I have personally begun to focus on and look for when building my teams up. Yeah, that's it.
All right. So how does accrediting and licensing agencies such as the Joint Commission and CMS affect and impact emergency preparedness programs in healthcare? Scott?
I kind of alluded to that in the last segment, but there's a lot of emphasis placed on that accreditation and licensing through health departments and whatnot. So there's standards that have to be met. There's policies and procedures that need to be developed, and then of course plans that need to be written. From there, it just, obviously we can't just let those plans sit there. The accreditation and standards indicate that you need to exercise those plans and make sure that they are accurate, they're vetted, and they function appropriately. And I think setting healthcare apart from other entities, I don't know of many other or organizational emergency management programs that have that annual requirement for drills and exercises like healthcare does. And I think that sets us apart. And quite honestly, organizations like the Joint Commission help to further that process along and ensure that we are ready organizations and we can respond effectively. So certainly it has an impact on us as programs, and it certainly has impact on us as professionals. I think it helps us to grow the profession and grow the capability in healthcare, and we become a better organization, a better prepared organization because of that.
Thank you. All right, I believe Scott's the only one that's going to be able to answer that question, so we're going to move on. How important is diversity, cultural competency in the field of emergency management, and how do I build this in my current role and future roles? Anyone other than Scott want to start with this one?
I'd be happy to kick it off. So it's incredibly important. In fact, I think it's probably one of the most important touch points for a successful emergency response from an NGO perspective. So I think first and foremost, what we need to acknowledge is that minority communities and ethnic minorities specifically are disproportionately affected and vulnerable to and impacted by disasters. And so these minority communities are also going to recover much more slowly after disasters because they're more likely to experience cultural barriers, linguistic barriers, like for instance, not being able to adequately communicate their needs or negotiate with responding agencies. And they're also receiving a lot of incomplete information, for example, or inadequate information that, or actually they're just often just left behind out of communication networks. And so having that cultural competency and a focus on diversity is so critical. So something to ponder is that, pain and need are universal, but the way that we express them is not universal. It can really be perceiving pain, expressing pain, that there's so much diversity just in that. And so learning how to approach each community differently. If you're going to be responding to a community that you're totally unfamiliar with, nobody is expecting you to learn the cultural nuances of that community day of, right? But if you have the opportunity and you have like a regional focus, for example, I mean, there's no excuse. You really need to be throwing yourself completely into learning that language. And if not learning the language, at least learning the like the power structures, who in the community has authoritative decision making, how to approach them, what are respectful protocols. But if you're approaching a completely unknown community to you, and I'm speaking from somebody who responds internationally, so that happens probably a lot more to me than somebody that works with here in the US, although there's so much diversity in our nation as well. Probably the most important tool is deference. Approaching a community with deference and respect, going into it, understanding that you don't know what they need or how to get them what they need. So never making assumptions about what they need, never making assumptions about how to make that work, how to help meet their needs, and just always coming from a place of, hey, we want to empower you in this situation. We're not here to help you. We are here to contribute to your ongoing efforts to serve your community. So really just I think just your perspective and your framing of your communication and how you plan to approach an emergency response is probably the biggest and most important step to cultural competency and that I can think of.
And Cydney, piggyback off of you because I really love what you said in terms of going into a situation to empower people. not to just put on your little red cape with the S on your chest and think you're just Superman or Superwoman or whoever, whatever superhero, and going into these communities that you're not familiar with and just taking over. There is a hierarchy in many communities, even communities here in the US, and especially in abroad as well. And so I think if we go into the situation with the mindset that we don't have all the answers, but we're willing to use whatever resources we have to empower those on their ground, not only in the moment, but to empower them to move forward even when our presence is long gone. I think that is so important as far as cultural competency is concerned. I think one of the biggest lessons that I learned with that topic was during the Ebola response. At CDC, we had sent out a bunch of different teams to West Africa. And even during Zika, we sent a bunch of teams to the south of the US. But one of the things in West Africa that we kept seeing, at least at the very, very beginning, was that the case counts just kept climbing every day. And we were like, what is going on? We have resources on the ground. We have people on the ground. What is going on? So I started having regular meetings with some of the officers and some of the civilians who were there and just saying, tell me about what's going on the ground and how are you all approaching the situation? And what we realized was that a lot of the people came over there from CDC, came over with like wonderful intentions and wanting to help and wanting to get moving and ready to go. And there were some plans in some cases, but they forgot one thing, and that was to honor the community that was there and the hierarchy that was in place long before that response was even thought of. So what we ended up doing was getting some anthropologists from CDC who did specialize in West African culture, and we sent them over just for the emergency purposes of things to educate those who were in West Africa that were staff. And then from there, those anthropologists brought back lessons learned stateside, and we were able to create packages, cultural competency sort of packages for our responders to be able to read through, and courses for them to be able to, get some high level good points on before deployment. So that we ended up seeing that once we did that, the case counts actually started coming down, which was absolutely incredible. Another part of that was learning the burial practices of those in West Africa, because we know Ebola is super transmissible when somebody is about to pass away from it, normally because it's hemorrhagic fever. So we can find it a lot on the skin, right? Anywhere there's pores or any holes in anyone's body, that pathogen is going to try to make its way out of. And so we thought in the beginning that it seemed like Ebola was targeting only the like those who were in charge of burial practices, so the spiritual leaders of the community. And we were like, oh my gosh, so why are the spiritual leaders being targeted and not the general population? And then we realized through cultural competency, we learned what their burial practices were. And so we were able to, through some of our anthropologists and some of our workers on the ground, to push recommendations forward for still being able to honor the cultural and religious burial practices, but doing so safely so that the leaders in these different areas weren't compromised health-wise. So yes, cultural competency is super important. Learning a language if you can is also another language if you can, as Cydney mentioned, is also extremely important as well. And if that's not your thing, if languages isn't your thing, it's okay. But still being open to learning other cultures and sort of merging them into your emergency management or your public health experience, I think will help you be more well-rounded, and also it actually saves more lives and also saves money as well, lots and lots of money.
Yeah, I can't add much more to that. It's a fantastic response. And the one thing I will say is we really have to do a better job in the profession to grow it across cultures, to look at our plans, to ensure that we are not leaving out various populations, various groups in our efforts. I think we're learning a lot about that through COVID. right now, and disparate populations, and how we can better serve at-risk communities. And I just think we as professionals need to take the after action. We need to act now, one, to make sure we get it done and do it correctly. But we also need to take the after action, what we've learned from this, and make sure it continues moving forward, and we have focused plans that encompass all of our risk populations to an equal stance, and that we grow our profession to become a more culturally diverse profession.
Thank you. What is the importance of interpersonal relationships in the emergency management field?
Oh yeah, I could talk about this a little bit. So one of the things that I've learned, again, my background is more in biology, and it wasn't necessarily an emergency response to begin with. And so through some of my work, I realized, oh my goodness, a lot of people in emergency management have a military background, right? I do not have a military background, although I am very grateful for all who have served and who continue to serve our country. But that was not my training. And so what I realized, especially in infectious disease responses, people with that emergency management sort of military background are like, okay, it's ready to go. It's a mission. We're given a mission. We got to execute, which is good. It's really good. But some of the processes that were used in the military are not necessarily applicable to emergency management, and are also not applicable to the public health side or infectious disease side of emergency management. So one of the things that I like to ask people, and you can use the raise hand emoji here if you want to in the group chat or at the bottom of your screen. But I'm going to ask you a couple questions, guys. So who loved group projects growing up, or even in your undergrad or graduate studies, who loved group projects? Let me see if people raise their hands. I don't see very many. Okay, so who hated group projects? That would be me. That would be me. I see Mike's in the comments saying, can I get a hand down? Exactly, that was me. That was me. I was like, oh my gosh, I was always the person who did all of the work all the time while everybody else went to parties. I want to be at a party too, I wanted to have a good time. But at the same time, I was just like, oh, let me get this work done so I can get my grade, right? So that I could get that GPA that I wanted. So what I like to tell people is that as you continue to do group projects in your master's programs and your undergraduate programs or whatever programs you're in, please make sure that you are taking more away than just what's on the surface. What's on the surface is the curriculum that you're learning, right? It's the certificate that you're trying to get, the degree that you're trying to get. Yes, definitely focus on that. But there's something below that too that's kind of supporting it that I don't think a lot of us talk about enough. And it is being able to figure out who you are and your personality to understand how you work with different personality types. I really, really encourage you to learn that perspective, to take those learning lessons away. If there's a type A personality, based on who you are, do you work well with the type A personality? Okay, if the answer is no, then how can your personality help bring out or honor what the type A personality has to bring to the table? Is there somebody who's really eclectic that you're just like, oh my gosh, I'm type A, I can't work with this eclectic person, they're all over the place, I don't even know what to do with them, right? There's something that they bring to the table and something that they offer. So how can you and your personality and who you are also work with that person, or work with at least a part of their personality type to generate what it is that you need, whether it's data, information, updates, whatever you might need in response, right? And I just so encourage everyone to do that, because as I mentioned earlier, emergency response, at least, is such a group project. It is nothing but a huge group project, except for in the emergency response world, it's not a grade or certificate that you're depending on. That's depending on you. It's people's lives that are at stake, right? So for me, even working with COVID, for example, there are lots of people that have to be at the table to make this response push forward. You need your epidemiologists, you need your laboratorians, you need your healthcare professionals, your nurses and your doctors who are on the ground pushing data up, right? From the local level to the state level. You need your policy people, right? Because we want to make sure that we're doing things in a way that's honorable and that's legal to help the general public, right? We need our IT professionals, because if we've not seen anything else more during this response, it's the need for, it's the critical need for connectivity without being in person. So we have this Zoom call, we have WebEx and all kinds of webinar platforms. There's this huge push to use GIS, like there's all kinds of stuff, right? All types of technology that are being used and developed as a result of this. There's a diagnostic test and everything. So there's so many people and so many different personality types and so many different backgrounds that have to come together in order to move this response forward so that we actually do have make an impact on our communities, whether it's a local level, like I said, state level, nationally, or globally, since this is a pandemic. So yes, emergency management is nothing but simplified. It's nothing but a huge group project.
So it's hard to follow you up because you say the right things at the right time, but
thanks, man.
But I will say from the health system perspective, Kim, how long have you and I known each other? 7 years or more. Kim and I have known each other, and the interpersonal relationships are huge. But from the health system perspective, while we work day to day as competitors, when something happens, we're there for each other and we have the relationships built. So one of the things I suggest is engaging in your healthcare coalition, which brings groups together, who otherwise would be competing entities against each other for the business. Work with your local emergency managers and get to know them and work with them so that when something does happen, you have those skills in place. So it's a tough role that we have to be part of a business and at the same time try and build trust and whatnot with the people that you try to work against every day. So but I think we've in many places we've found that balance, and it works out really well.
Yeah, I would just add, so well said by both of you. Thank you. I would just add that understanding who your counterpart is, who plays your role in the community that you're working with, is so incredibly important. And if you're afforded the opportunity to cultivate relationships with them and that rapport way before the emergency happens. So a successful emergency response is really the level of preparation is just absolutely critical. And preparation isn't just internal, it is who you are preparing with, so you can better understand their communication style, their limitations, their gaps, their strengths, and really building that trust from as soon as you can. So at Direct Relief, we ship medical aid around the world, which is way more complicated than you can imagine. Giving free medicine away and even money is actually really hard. But we do that on an ongoing basis because the communities that are most vulnerable in an emergency are also most vulnerable just on a regular day. And sending aid and emergency sending medical aid is going to be difficult on a normal day. And so having those relationships and those supply chains and those systems set up ahead of time is probably the most critical part of preparedness. Having like a well-oiled engine and knowing who is on the receiving side and what they need in order to process it on their end. So just trust building and interagency networking is always important. It's just the name recognition. If you're working with somebody that's in the midst of a crisis and they're trying to respond to their community and make decisions and this and that, just the name recognition. Oh yeah, I have a positive association with that person. I met them at a conference 2 years ago. Okay, I'm going to engage in this conversation. I don't have a lot of time, but it's just, yeah. So getting yourself out there, making making your position and what you have to offer to any one emergency response known, so people know who you are and how and when to call upon you and your help.
All right, thank you all. Red flags for healthcare professionals going into the EM field. What are some things they should avoid or flat out not do?
I'll start that off. They should not walk into a situation. There you go. When you have people that come into situations, that it's okay to be confident. Now, I'm not saying that. You should definitely be confident in your practice and your area of expertise, your subject matter area of expertise. But don't, it's a red flag to me, those people that come in acting like they know everything. Oftentimes, not all the time, for me, they've been very reactive, and that's not what you need in an emergency. It's not, it could actually take the response in a negative direction, and there's a lot of cleanup that often happens as a result of that. So for me, a red flag is the person who just comes in acting like they just know everything. They don't want to listen to others. They don't want to, it's very difficult for them to work with others. It's a no-no for me. I don't care what degree you have or don't have, or how many certifications you have or don't have. It is not impressive if you cannot actually get the work done and do it well.
Thank you.
Welcome.
Cydney, Scott?
I would say, yeah, to kind of continue on to what Latoya was saying, never make a decision that could have consequences based on unfounded assumptions. It really is absolutely worth the extra time to get answers and get information before making a reactive decision that could affect many, beyond what you initially see. For example, choosing to send an emergency shipment to a country in need because you know that they need it. You had some sort of initial conversation with somebody expressing the need. You haven't gotten the green light yet. You don't know if they're going to be able to receive it. You make the assumption that they're going to. You send it, and what does it do? It takes up valuable space on an airplane that could be replaced by something that is potentially higher need. There's only so many airplanes in the world and so many buses and trucks, so many people to manage those resources. Then it arrives in country and they don't have approval to import it. And so what does that result in? It results in a shipment of medicine or whatever you're sending sitting on a tarmac and taking up space with nobody to move it, and amidst a total chaotic situation. So that's just, one example of how, you really need to play out the long-term consequences of making a decision. And this is not like acute, human impact, like how this would affect in somebody in a clinical setting. This is just a different approach just based on where I work. And I guess the only other thing I would say is that when you're entering into an emergency response situation, making sure, I know this is kind of like the what to do instead of what not to do, or okay, so I'll frame it like that. Do not go into a situation without knowing how you are going to be able to ensure your own personal safety, because then you become a burden on the community. And if you are put into a dangerous situation, whether it be exposure to a virus or not having a safe place to stay or whatever that is. I mean, I've been in those situations where I've been promised a safe place to stay. I arrive, I didn't verify, I just was promised via WhatsApp. I went and I ended up staying in a room shared with strangers. And this was in a post-earthquake response in Mexico. And there was just this huge crack above my head, and the building shook all night, and it could have collapsed at any time. In fact, it was the only standing building in the town. So that was probably one of the most dangerous situations I've put myself in, and that could have been really remedied by really confirming that I had a safe place to stay. That could have very easily lended to a situation where I was then putting a burden on an already really stressed health system and safety system. So that's all I'll say. Thank you.
Can I add a little bit onto that really quickly? Just hearing what you just said, I was like, oh shoot, I didn't even think about this. Making sure that if you're responding to an emergency, that you pack enough equipment that's not too burdensome and too heavy to be able to sustain yourself. At least I tell my people 24 to 72 hours, because you just never know sometimes when you're going to be deployed to these situations, if there's going to be electricity, if there's going to be clean running water, depending on where you're at in the US or in the world. So definitely making sure that you pack according to the response. If it's a Zika response, then you probably need to pack some bug spray and maybe a bed net, right? If it's an infectious disease response, you definitely need your PPE, and COVID-19 is a perfect exercise in that. Like, we're all exercising PPE right now. So yes, definitely making sure that you're prepared to sustain yourself, whether it's with MREs or some sort of snacks or something. We just had some officers deploy, or some people deploy, and they ended up in a small town where the airport closed really early and everything around the airport closed, including the car rental places. And so they were having to sit in this dark area by themselves with no food for quite some time, until someone was able to drive really far out to come get them. But the good thing is that person was prepared. They had snacks and things like that inside of their bag, so they were able to sustain, at least for the time being. They also had safety equipment as far as lights, flashlights, and things like that, to be able to flag people down if needed, or see where the things weren't visible. So that's a real thing to consider, is what are you packing in your emergency response bag? That's it.
And also never taking the decision to deploy to an area without making sure that your entire team knows where you are and what you are going to do. It's easy to just look around and say, okay, this isn't happening fast enough, I'm just going to go and do it. And that's actually really, really dangerous. So your personal safety really ends up affecting your entire team. And so just informing them, getting approval, making sure they know where you are, is going to ensure that that you can be assisted and supported if needed. And just from a woman's perspective, there's a lot of situations that I wouldn't that I probably wouldn't take on alone, and that can happen just here in my own community and abroad as well. And so just being realistic about those risks. Yeah, there's no everybody just needs to that cape mentality, is hang the cape up and just walk into it as a human, using your skill set. There's you are not impervious to the risks that the same community you're going to respond to are mitigating.
Thank you. These are all really good responses. We are coming close on time, so we do have one question here that got asked that I wanted to make sure we get a chance to answer out loud, if anybody has any quick answers to this. Someone posted a question. I'm an EMT and recently obtained my MPA in disaster management. I have limited EM experience outside of incident management. Is there any suggestions? Oops, sorry, that's the wrong one. Hold on. No, I'm correct. Is there any suggestions as to how I can focus my time to gain additional experience?
I'll take first part of that. In many communities, the local emergency management program is a volunteer agency. In Pennsylvania, there's 2,000 of them or more in our local municipalities. So while it may not be the optimum thing to do, you can gain experience by volunteering in your community with that local emergency management agency or the county emergency management agency in a role where you can learn how to do one of the functions. We many in healthcare also accept internships as well, and many have programs in place to grow in that capacity. So having a little bit of background in healthcare would be helpful in that capacity. And I know in my programs, what I like my interns to do is to take a specific project and run it from start to finish. so that you gain the experience of the development of a plan, or the development of the project, and see it all the way through to the end. So that's one way I could say to gain that experience. And then of course those FEMA classes, just keep plugging away at them.
Perfect. Does anybody else have any quick responses to that?
I think what Scott said really covers it well. Education and these trainings are so critical, but they're all theoretical until you're in the situation. And so learning, just gaining some hands-on experience, even if it's just piecemeal via volunteer experiences, is incredibly important. And a lot of communities don't have the resources to have a fully funded emergency management team and positions within the county or city. And so knowing how to plug in as a volunteer, and making sure that they know who you are and what you're studying. I mean, that's incredible that you're pursuing that degree, and your immediate community should definitely know that. You are already an asset to them. So jumping in and just making sure that they know what you have to offer and that you really are looking to gain that experience.
Yeah, one of the other things that I would say really quickly is don't be hesitant to utilize some of the resources at your disposal, such as like LinkedIn, and then making connections with people, because sometimes you're able to really just type in, emergency management, this specific county, this specific state, where you may want to move to, you may know the company that you're or the health care system that you may want to work with. Whatever. So if you can find somebody in these systems and add them as a connection, you might have to create that generic introduction paragraph that you send out to about 10 different professionals. But if they can, any one of them can have that informational interview with you and get you to that next step, or ask them. I used to always ask people, what certifications did you do specifically? What educational background do you have specifically? And the responses are always very different, especially when you get into the emergency management field. From firefighters, EMTs to collegiate students, you all will have like that unique path. But the first step is really just breaking that invisible barrier that a lot of us had faced when we first got in. But the best part about the EM field is a lot of us are really interested in sharing information, and how we pass that. So continue to stay connected with, the Emergency Management Growth Initiative on LinkedIn, but then also, feel free, people have their first and last names on this panel. Connect on LinkedIn. Feel free to connect with any of us. You can see our experience level, and if it's something that you're interested in, feel free to send a message.
That's perfect, Lewis. Thank you. At any minute now, you guys will probably the attendees should be receiving an email from me. It's going to just be a quick survey. We're always trying to make these panels better for all the different ones we do. So just take a couple minutes. How did we do? What did you like? What can we improve? And then how did you hear about us? That way we can see where we're getting the most visibility at and where we can, reach out to others. And before we close out here, I'm going to let Lorraine speak a little bit about EMGI real quick.
Thank you, Tammy. I honestly just wanted to take a moment to thank all of our audience members for tuning in tonight and listening to our expert professionals, Kim, Latoya, Cydney, Scott. It was really fantastic to have you with us and hear from your on-the-ground experience working in this field. So again, just thank you. And for our audience members, we have a lot more initiatives, as Lewis just mentioned. We have an emergency talk dinner coming up on Monday. That one might be even of interest to you, especially if you're just starting out in emergency management, because we will be discussing how do we define ourselves and what comes with that. So definitely check out our website with all of that information. And we hope to see you at a future event. And if we can do anything for you, just feel free to reach out. Thanks.
Thank you, Lorraine. All right, and that will be it for tonight. Thank you to all the panelists for your time tonight. Thank you for the attendees for joining us. Like everyone was saying, feel free to check out our website, check out our LinkedIn. I know we have one more panel coming up under the career, focusing more on Peace Corps, AmeriCorps, FEMA Corps, and opportunities with them, especially because there's going to be a big federal funding push towards those organizations soon. And then part 2 will start up probably early to midsummer. And that's going to be focusing more on landing that career, volunteering and internships, resume writing and interview skills, followed up with some leadership skills. So stay tuned for all the information to come on that. And thank you again to everybody. Have a good evening, day, or whatever time zone you're in.
Thanks, everyone.
Thank
You all, and good night.
Good night.